Over the past couple of decades, a sizable body of research has emerged suggesting that religious participation is strongly associated with numerous health and well-being outcomes. Large, well-designed research studies have indicated that religious service attendance is associated with greater longevity, less depression, less suicide, less smoking, less substance abuse, better cancer and cardiovascular disease survival, less divorce, greater social support, greater meaning and purpose in life, greater life satisfaction, more charitable giving, more volunteering, and greater civic engagement. While some of the early studies on this topic were methodologically weak, the study and research designs have become stronger and stronger, and for many of these outcomes, the associations are now considered well established. Religious service attendance powerfully affects health and well-being. Religious communities allow people to flourish. In this talk, I will describe in greater detail this research. I will further explore why religious service attendance seems to so powerfully affect health and well-being, and I will conclude with some discussion of the implications of the research. It should be noted that the primary end of religion itself is not simply flourishing in this life, but in many religions, final communion with God, both here and now and in the life to come. In the words of Thomas Aquinas, we have on the one hand the imperfect happiness that can be had in this life, and then also the perfect happiness, the complete satisfaction of the will that consists in final communion with God. My focus here will be, perhaps sadly, on imperfect happiness, on those aspects of well-being, of health, of wholeness that pertain to this life, and how religious communities contribute to these. Given the focus of religion itself on the transcendent, however, it is perhaps remarkable that participation in religious communities affects so many well-being outcomes in life here and now as well. In any case, these more mundane aspects of well-being are also admittedly rather easier to study with data. But perhaps more importantly, in considering the implications of the research, I would like to put forward arguments that some of the implications of the work follow irrespective of one's theological commitments or lack thereof. They are of relevance even in a pluralistic society. So let us turn to the data. Some of my own research on this topic from Harvard's Initiative on Health, Religion, and Spirituality and Harvard's Human Flourishing program was published in 2016 by the Journal of the American Medical Association. The research used data from the Nurses' Health Study with over 70,000 participants followed over 16 years, and we found that those who attended religious services regularly were 33% less likely to die over the 16 years of follow-up. We also found that those who attended services regularly were 27% less likely to become depressed. They were about 50% less likely to divorce, and they were 5 times less likely to commit suicide. These are large effects, and they are large effects for numerous important health and well-being outcomes. Other research that we have done has suggested that it is religious service attendance rather than private practices or self-assessed religiosity or spirituality that most powerfully predicts health. Something about the communal religious experience seems to matter, and it is something very different from private practice. Religious identity and private spiritual practices may of course still be very important and meaningful within the context of religious life, but they don't appear to affect health and well-being as strongly. Something about the communal religious experience, about religious service attendance, is important for health and for many other outcomes as well. Similarly, some of our other research indicates that a religious upbringing also profoundly affects subsequent health and well-being. Children who are brought up attending religious services are protected from what are sometimes called the big 3 dangers of adolescence: depression, substance abuse, and risky behaviors. They are also more likely to be subsequently happy, to be forgiving, to have a sense of mission and purpose, and to volunteer. And our most recent study, published in the July issue of Journal of the American Medical Association Psychiatry in 2020, indicates that religious service attendance protects also against the so-called deaths of despair, deaths by suicide, drug overdose, or alcohol, and reduces such deaths by 68% for women and 33% for men. The empirical research thus establishes important connections between religious service attendance and health and well-being. Given the powerful effects of religious participation on health and well-being, we might wonder why these effects are present. In the second and longest part of the talk, I will discuss the empirical research on what the mechanisms might be. I will also discuss whether and the extent to which the mechanisms are distinctively religious, and what religious teachings themselves suggest as to why communal religious life is so important. If we begin with health and longevity, one explanation would be social support. And indeed, the research does indicate that social support is important. But it seems to only explain about a quarter of the effect of attendance on longevity. Other mechanisms seem to be operative as well, and we've shown in our research that decreased depression, decreased smoking, and increased optimism and hope, and a greater purpose in life are also important mechanisms for improving health. The existing evidence also suggests that the mechanisms may vary across outcomes. For the effects of religious service attendance on decreased depression, the mechanisms of social support, optimism, or hope and meaning in life might all be important. For greater life satisfaction, the social relationships that religious services seem to provide play an especially important role, perhaps accounting for nearly half of the effect. For the dramatically lower suicide rates among those attending religious services, while it is the case that social support, less alcohol, and less depression may account for a bit of the effect, these factors really were not as explanatory as we had thought. And the moral belief that suicide is wrong, reinforced by churches and religious communities, is perhaps here of considerable importance. With lower divorce rates amongst those attending services, the programs within religious communities that support families and marriages are likely important, as are the teachings on love and sacrifice, the prohibitions against infidelity and divorce, and the greater levels of life satisfaction and lower depression within married life. These may all be important mechanisms. There thus appear to be many pathways from religious service attendance to health and well-being. Another important pathway may be forgiveness. Christianity, for example, promotes forgiveness of others when they have wronged you. The relationship between forgiveness and health has also received considerable attention in the past years in the empirical research literature, and this has suggested that forgiveness itself is closely tied to health. Forgiveness is often conceived of as replacing ill will towards the offender with goodwill. Forgiveness is thus distinguished from condoning or excusing the action. It's different from reconciling. It's different from forgetting or forbearing, and different from not demanding justice. These things are all separate from forgiving. One can forgive and also demand justice. One can forgive and still hope for the ultimate good of the other while still pursuing a just outcome. The existing research suggests that forgiveness is itself associated with better health. A recent review and also randomized trials of forgiveness interventions to help people who want to forgive but find it difficult to do so, indicates that forgiveness is associated with subsequently having less depression, less anxiety, and greater hope. The mechanisms are generally thought to be beneficial regulation of emotions, and forgiveness being a helpful alternative to maladaptive responses like rumination, returning to the offense again and again, or suppression, pretending it didn't happen. Forgiveness workbooks have recently also been developed by Everett Worthington, the REACH Forgiveness Workbook, and we're currently testing the efficacy of such workbooks in large randomized trials of about 3,000 people in 5 different countries: Colombia, South Africa, Ukraine, China, and Indonesia. The evidence to date, however, does suggest that forgiveness itself can be very powerful. We might also gain some insight into what the most relevant mechanisms might be from religious teachings themselves. And here I will turn explicitly to my own tradition, the Christian tradition. Some of the power of religious service attendance might be the accountability between members of a community. We read in the 18th chapter of the Gospel of St. Matthew, for example, that if your brother sins against you, go tell him his fault, between you and him alone. If he listens to you, you have gained your brother. But if he does not listen, take 1 or 2 others along with you, that every charge may be established by the evidence of 2 or 3 witnesses. If he refuses to listen to them, tell it to the church. In these instructions, each member of the church is to hold others accountable. This first takes place on an individual level, then within a smaller group, and finally within the entire church itself. The accountability helps with correction for behaviors and relationships that may be problematic. It helps bring about change and reconciliation and forgiveness. This sort of accountability, however, does require communal religious life. It cannot operate in solitary practice. Another reason as to why communal religious participation rather than just solitary spirituality may be so important comes from the letter to the Hebrews. In chapter 10 of that letter we read, "And let us consider how to stir one another to love and good works, not neglecting to meet together, as is the habit of some, but encouraging one another, and all the more as you see the day drawing near." Thus, the community not only holds each other accountable to avoid what is wrong, but also is to encourage each to pursue what is good, and to encourage love for the other, the seeking of the other's good, which may explain some of the effect of religious service attendance on social support, on lower divorce, on greater meaning and purpose in life, on greater life satisfaction, more charitable giving, more volunteering, and greater civic engagement. St. Paul's metaphor of the church as a body may also help us understand part of the power of communal religious life. In his first letter to the Corinthians, Paul writes, "For just as the body is one and has many members, and all the members of the body, though many, are one body, so it is with Christ. For the body does not consist of one member, but of many. The eye cannot say to the hand, I have no need of you, nor the head to the feet, I have no need of you. On the contrary, the parts of the body that seem to be weaker are indispensable. Now you are the body of Christ, individually, and are members of it." In communal religious life, one person's strengths offset the other's weaknesses. Through our various strengths and weaknesses and the help we provide one another, members of religious communities are supported in religious faith and in spiritual growth and in much else as well. But Paul's use of the body imagery is intended to push beyond just being a metaphor. Paul describes the church in his letter as the body of Christ. The church makes Christ's and Christ's love present to the world and to each other. Similar ideas again expressed in the Gospel of Matthew. If we again return to the 18th chapter of the Gospel, we further read that Jesus told his disciples that where 2 or 3 are gathered in my name, there I am in their midst. In some deep sense, we experience God himself through religious community and through the Eucharist. The transformative power of such an experience of God is perhaps difficult to quantify and measure, but if it truly is an experience of God, this may then likewise explain the many powerful effects of religious service attendance on health and well-being. Certainly God is also experienced in prayer and contemplation and in other ways and places, some of which may be solitary. But the communal experience of God, as we have seen, is most certainly given a strong place in Christian teaching. It is an important part of the pursuit of God. It is important to health and well-being as well. So what are the implications of this research and of these ideas? And this will be my final topic of this talk. What are we to make of this work, and what practical conclusions might we take away? Of course, people do not generally decide to become religious for health reasons. Such decisions are made more on the grounds of experiences, evidence, truth claims, upbringing, values, relationships, and so on. My own view with regard to the interpretation and implications of the results are fourfold, and they concern first religious communities themselves, second counseling and care, third society and policy, and fourth individual decision-making. Let us begin with the first, religious communities. The research, I think, may be of interest and importance to religious communities. The research helps support a message about the power and importance of communal religious life. That it is religious service attendance rather than private practices or self-assessed spirituality that seems most strongly to affect health and well-being suggests that there is something important about the communal religious experience. The research carries a powerful message that religious communities can communicate. Religious communities can point to empirical data that suggests that it is not just belief that matters, but attendance and community participation as well. So the research may be of interest to religious communities, but the research may also be of interest to healthcare providers and counselors and anyone providing care. The research can make clear that religious participation is a powerful influence on health and also on health decision-making. The role of religion and spirituality in patient care and medicine has been controversial. The majority of American patients and many elsewhere also say that they think that physicians should consider patients' spiritual needs in clinical practice, but many physicians feel uncomfortable doing so. Religion and spirituality in one study were ranked as one of the two most important factors for patients' medical decision-making out of 7, but 7th out of 7 for physicians. So how can these complexities be navigated? Some have suggested taking a short spiritual history within a clinical context, using questions such as, which are relatively neutral, is faith important to you in thinking about health and illness or at other times? Or alternatively or additionally, do you have someone to talk to about religious matters? Or would you like to have someone to talk to? Such questions are relatively neutral and can be asked even if the clinician and the patient don't share similar religious beliefs, but they may help the clinician assess whether religious faith plays an important role in a patient's life, and whether the issue should be discussed further if a referral should be made. We might also inquire as to whether there's a role for clinicians in encouraging service attendance, and this is perhaps yet a more controversial area. Certainly the research results on religion and health do not imply that physicians should universally prescribe religious service attendance. Once again, decisions about religious practice and formation of religious beliefs are not made on the grounds, principally on the grounds of health, but rather reflect values, relationships, experiences, evidence, thought, upbringing, and numerous other commitments. However, for those who do already positively identify as being religious, service attendance might be encouraged, perhaps even in a clinical setting, as a meaningful form of social participation. Due caution is needed for those who may have had prior negative experiences or even abuse in religious contexts. But the spiritual history questions described earlier may help assess whether this may be so. It is clear from the research that communal religious participation has powerful effects on health. And to neglect this is to neglect a powerful health resource. We might also turn the question around and ask if clinicians, in withholding this information from patients who already self-identify as religious, if they withhold this information, are they in fact doing harm? So the religion and health research is relevant to religious communities and relevant to clinicians and counselors and caregivers. But I think, third, that the associations between religion and health and well-being may be important in reevaluating the role of religion in public life. The media, the academy, and broader public discourse often portray religion in a rather negative light, and certainly there are instances in which religious institutions have done harm. But the effect of religious participation and health and well-being are also often profoundly positive as well, across numerous domains of life, and this point has too often been neglected. For example, there's been recent concern about rising suicide rates within the United States. Our own studies indicate that if one were to extrapolate our results to the national level, which is a jump, but if one were to do so, it would suggest that of the rise in suicide rates over the last 15 years, about 40% of that is attributable to declining religious service attendance. So religious service attendance really should be taken seriously in public health discussions and discourse. It truly is an important social determinant of health. And I think these things do have important implications for the extent to which society promotes and protects religious institutions and religious freedom, the maintenance of their nonprofit tax-exempt status, and how the contribution of such institutions are portrayed in the media, in the academy, and beyond. Of course, a lot has changed with the present COVID-19 pandemic. Many churches and synagogues and mosques and other religious communities have, at least for a time, had to close to prevent the spread of infection. Many religious communities have found ways to at least partially offset these losses. Many have moved, for a time at least, to virtual services and webcasting. Others have established online discussion groups or studies of Scripture. Many have encouraged increased personal and family devotion, prayer, and ritual. Some have even established a drive-through prayer or confession. Each of these contributes, though none is likely to be a fully adequate replacement to the in-person meetings and community. To what extent do the effects of religious attendance extend to these forms of virtual practice? We don't really know. Probably some do and others do not, or do only partially. When the present pandemic has passed, it will be important to reestablish face-to-face meetings and services, rather than relying entirely on technological alternatives. But again, I think the importance of religious community needs to be appreciated in the media, in society, in policy, in the academy, and elsewhere. It contributes to health and well-being. Fourth, and finally then, I do believe the research also has implications on a more individual level. My view with regard to the individual implications of the research is that for the roughly half of all Americans, and many more worldwide, who do believe in God but do not regularly attend services, the relationship between service attendance and health may constitute an invitation back to communal religious life. Something about the communal religious experience seems to matter. Something powerful takes place there. Something that enhances health and well-being. And it is something very different than solitary spirituality. In an era in which people increasingly identify as spiritual but not religious, and in which the term organized religion often carries negative connotations, the research perhaps challenges preconceptions and suggests that personal spirituality, discarding all organized and communal aspects of religion, may not be an entirely satisfactory way forward. The research questions whether those who do not attend may be missing something powerful of communal religious experience. Powerful at least for health, and possibly for much else as well. Where else today do we find a community with the possibility of a shared moral and spiritual vision? A sense of accountability, wherein the central task of the members is to love and care for one another. The combination of the teachings, the relationships, the spiritual practices, over time, week after week, taken together, gradually alters behavior, creates meaning, alleviates loneliness, and shapes a person in ways too numerous to document. Religion brings true human flourishing. Thank you.